Hello, I'm Dr. Stephen Blomerth, and welcome to our show, Natural Health Today. This is a show that's dedicated to your concerns, your health questions, and what we try to do is encourage viewer participation in our show by letting you write in your questions or call in or email us. And what we do is we offer you a chance to talk about or ask questions about your health or a friend or family member. And there's three ways you can participate. One way is to send in an email to pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can send an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. But whichever way you choose to participate, what we'll do is we'll slightly disguise your name so your friends and neighbors won't know exactly what kind of a problem you're inquiring about. And what we'll do is discuss some natural ways that you might be able to be helped. And there's basically four avenues that I think of when I think of natural health care. One approach is via manipulation to joints that are stuck, because a joint that is stuck is not going to get better no matter how many pills, no matter how many shots, or how many operations you have. It needs to be moved when it's stuck by hand, and it can not only decrease pain, but it can also free up nerve flow to the area. Another avenue of treatment in natural health care is muscle therapy, and I'm not just talking about massage. I'm talking about trigger points and myofascial release when people have knots in their muscles that may be major or may be slight, but they can produce a dysfunction or a lack of proper movement in an area, and that can have far-reaching effects as well. And these types of approaches can do wonders with people who have had pain sometimes for years and have never been able to resolve their pain by standard medical care. Another approach to natural health care is exercise. And I'm not talking about the exercises you get in a gym. I'm talking about stabilization exercises that do two things: stretch muscles that are overly tight and strengthen muscles that are overly weak. And the best avenue that I found in my 37 years of practice for that is exercises developed by foundation training. And you can look up foundation training on the internet. They have a fantastic program, and I've been doing foundation training exercises myself for about 7 years. I find it helps your posture and your general health to do these exercises. And the last avenue of natural health care that I think about is nutrition. A lot of people wonder, well, what does nutrition have to do with my problem? Many times nutrition is kind of the background level of health that you have for all different types of problems. And I found that over time, nutrition is probably the biggest single way for you to have more energy, stay younger longer, and get better no matter what type of problem you have. And it's a lot more than just eating the four food groups. So we talk about nutrition as not only things that you eat, things that you probably shouldn't eat, and also from time to time supplementation with either nutrients or herbs. So those are the four avenues of natural health care that I think of. And I would say fully 80 to 90% of day-to-day health care problems that people ordinarily take to their medical doctor and end up getting treated by drugs or surgery will respond quite favorably to knock out your pain, to get you back to normal, to restore normal function by natural health care. Most people for day-to-day health care problems don't need drugs and surgery, and we talk about ways you can be helped. If you can't be helped, we also talk about people who can't be helped by natural health means and need to consult with a standard medical practitioner. But most problems, the day-to-day problems, the run-of-the-mill, the headaches, the back pains, the sprains and strains, that's the type of thing that can be helped without drugs and surgery. So I'm going to put on my reading glasses and read some of the questions that have come in. since our last episode. Okay, our first question is from Anne. Anne writes in from Danvers. She says, I fell on the ice 2 years ago and landed on my left knee. I was so embarrassed at that time that I bounced right back up and walked away. My knee's been pretty good ever since then, but in the back of my mind, I wonder if I did anything to injure my soft tissue, because now it hurts when I kneel on it for about 10 minutes or so in yoga. Does that sound bad? What should I do about it? Okay, let's just review what Anne said in her letter. She said she fell on the ice. She said it was about 2 years ago. She mentions that she was able to bounce right back up and walked away. But now she's wondering if she might have hurt her knee more substantially, because when she attends yoga classes and kneels on it for about 10 minutes, she gets pain in her knee. Well, an injury that you have 2 years ago doesn't necessarily go away if it's not treated. But the fact that you were able to bounce back up and walk away means, to me, it wasn't that severe. You probably didn't break anything, because if you broke a bone, if you tore a ligament, you're not going to be able to walk away and feel relatively pain-free for, that 2 years length of time. Now, does that mean that the injury totally went away? No, it may not have, because when you fall hard enough on your knee, it may not only affect your knee, you may affect several joints, muscles, and tissues in the area. So what Anne says brings out her pain most is kneeling on it. What we do when a patient like that comes into the office, we examine them more with just our eyes. We do run certain hands-on tests, but we also palpate, which is a fancy way of touch the area, and we look for certain sites where a person can be injured around the knee. And when we find a site like that, we do a quick test to see, does that bring out the pain? Because if the tenderness in the knee doesn't bring out the pain that Anne is complaining about, it just means it's everyday tenderness. For instance, your eyeball. I don't care what day of the week it is, whenever you press on the eyeball, it's going to be tender. Some parts of our body just are inherently tender. So what we want to do is compare, say, her left knee to her right. If it's about as tender on the right as the left, it means that's just how Anne is. She's tender when we touch that area. But if we press on that area and it brings out the pain that she gets when she's kneeling on yoga, that says to me, okay, that's the site to look for. So pretty commonly in the knee, when you have an injury, you can have the pain go away for the most part after an injury, but it may come out during very specific and limited activities. What Anne said is she's pretty much normal. She can walk and do all the things that she normally does, but when she kneels on it, she has pain. It doesn't mean that she's crazy. It just means that her injury is somewhat limited, and it can usually be helped. The type of therapy that I would recommend if I found a spot like that is transverse friction massage, where you get on that area, and I would illustrate, say, right here. If I had an area here that I injured in the past, I would go back and forth across that muscle area, and down the knee. If we found that tender spot that reproduced the pain, we'd go back and forth across that area, because the body can form scar tissue deep inside. Just about everybody knows about scar tissue. When you have a cut on the outside, you form a scab and a scar, and over time it mainly goes away. But if you cut yourself pretty significantly on the surface of your skin, you may notice kind of a hard aspect underneath that. That's called scar tissue. And that scar tissue can impact the function, the way the tissues underneath glide and slide and move back and forth. When you have an area that doesn't move properly, it will be tender when you kneel on it. Ordinarily, if you kneel down the floor, you shouldn't have pain in your knees when you do that. But people do get little injuries over time, so the therapy for Anne might be to go back and forth across that area to free that up. And then we can usually follow it up with something called kinesiotaping. I think I brought that kinesiotape in previous shows. I can demonstrate that on a different show, but it helps reinforce that area, helps the area heal up. And we know that we're on the right track because what I would do with Anne is have her go back immediately after treatment and do that same kneeling thing that she did in yoga and see if the pain is diminished. If the pain is diminished, it says we're on the right track. Will it go away with only one treatment? It may take a time or two because after 2 years some of the scar tissue might be entrenched. But that's a good process to go through. Find an activity that brings out the pain, treat that area, have the person redo that activity immediately and see what the fallout is. If the patient feels worse, it means we're doing the wrong thing or we're doing it in the wrong area. If the patient feels better, it's a very good indicator that you're on the right track. So Anne, I hope that'll help. Do I think it's serious? I don't think it's serious, but I don't think it's nothing. In other words, I wouldn't worry about that type of thing, but I wouldn't neglect it because if you enjoy doing yoga, why shouldn't you be able to kneel on your knees for a short period of time? I think she said 10 minutes or so. So you should be able to kneel on your knees for about 10 minutes or so, unless you're kneeling on glass or something like that. And you could probably be helped, so seek some care, and thanks for that question. Okay, our next question is from Brian. Brian writes in from Middleton. He says, I hurt my back about 20 years ago in the Marines when I was carrying heavy weight with another guy, and he let it go, and as the equipment fell, I twisted my back to avoid it falling on my foot. I've had pain off and on ever since then. I had an MRI done and some x-rays, and they say there's nothing wrong, but it still hurts me every day. Just standing still it hurts. And I don't want to take more and more medication for it. They just make me feel tired. Any ideas what could be wrong when the x-rays say there's nothing wrong? Well, Brian, that's a fairly common scenario. You injure yourself and it doesn't go away, and somebody will take some x-rays or an MRI exam and they'll say, oh, nothing wrong in that area. When you take an x-ray or an MRI, what are you looking for? People are looking for fractures, they're looking for tumors, they're looking for what we call malformation. In other words, did that area form with an abnormality in it? X-rays and MRIs are good because they can rule out a fracture in an area, they can rule out a tumor, they can rule out a malformation. But they don't show how things work. When a medical doctor says there's nothing wrong in an area, he means there's no fracture, there's no tumor, and there doesn't seem to be an abnormality in the way your bones and your joints formed. But that's all it means. It doesn't mean you don't have a joint that's stuck. It doesn't mean that you don't have a muscle trigger point. It doesn't mean that some ligaments in the area haven't developed some scar tissue from an activity where you injured yourself 20 years before. It doesn't mean any of those things. All x-rays do, and all MRIs and CT scans, all these imaging devices do rule out things that are good to know. They rule out fractures, they rule out tumors, and they rule out an abnormality in how you grew and formed. They don't show pain, they don't show trigger points, they don't show very important things. So you can have a pain last, as we just heard. Brian said he had it 20 years ago when he was in Marines, and it still plagues him today. He's gotten some treatment for it, but it's never gone away. Now I'm guessing that if Brian was in the Marines, he probably got standard medical care from the Marines and the Naval Department, and maybe even from the VA, that would include all kinds of therapy not designed to detect whether there's a problem in a joint, not designed to help muscles, not designed to help you with a ligament. They're designed to mainly help people who have fractures, tumors, and malformations, and most people don't have that. So the therapy he has gotten hasn't been directly important to get him better. Proof in the pudding is he's still having problems after 20 years. So when I would look at a patient like Brian, I would say, well, why don't you take your shoes off and let's have a look at how your feet look. Why? Because he mentioned that just standing still, he has pain. If you have pain from just standing still, it means maybe something's off with your feet, because your feet are the foundation of your body, much like the cellar is the foundation, is the basement of your house. If you don't have a good foundation, whether it's in your feet or in your house, you can have all kinds of problems. And it might not necessarily show up in the basement or in your feet. So when Brian says, hurts just standing still, I think of feet. Have a look at the feet. Treat the feet. You don't always necessarily treat right where the person feels the pain. When people have pain in an area, it's the result of many things gone wrong. It doesn't necessarily even mean that the problem is in the area that has pain. It just means that the person perceives the pain there. So the idea is to treat what's wrong and see if the pain doesn't go away. And that can be achieved by some of the ways I mentioned previously. But it takes the proper exam. And if Brian had had the proper exam to date, he would be fixed by now, because 20 years is plenty of time to get better if you receive the proper care. If you don't receive the proper care, there's no limit to how long it can take a problem to go away. These types of problems, unless they're treated properly, in other words, unless the joint that's stuck gets put back into place or returned to proper movement, if the muscle, the trigger point that has a problem, doesn't get the proper care to free it up, it'll still have a problem. If that ligament or tendon has some scar tissue on it from twanging your back 20 years ago when you twisted, when something heavy fell out of your hands, that pain won't go away naturally on its own either, unless and until it gets addressed by the proper modality. And the proper modality isn't usually going to be drugs and injections. So Brian, there is hope for you. You just have to receive the right type of examination, right type of care. It's good that you had x-rays and MRIs, because they rule out some serious things, because it is serious if you have a fracture, if you have a tumor, or if you have a malformation of a particular area of your body. That's good to rule out. Now it's been ruled out, you still need the proper exam in addition to that to find out where your point of lack of proper function. We have a fancy word for it. It's called dysfunction. You probably heard the word dysfunctional family. Well, the same thing can be used about your body and your spine, your joints, your muscles, and your tendons. If they don't move, if they don't glide, if they don't slide, if they don't function the proper way, they have a lack of proper function, and that almost always results in pain. It's good that you had your previous exam. Now you need to have the right exam and the right treatment, Brian. So thanks for that question. I'm sure you can be helped, but you've got to get the right type of help. Okay. Our next question is from Rich. Rich writes in from Beverly. He says, I have been disabled for about 14 years now because I had a heart attack, but I have another problem that no one can seem to solve. I almost passed out a couple of times because my blood pressure got so low. But all the tests come back negative. A few docs think I'm faking it, so I don't know what to do. Okay, Rich, well, let's just go over what Rich had to say. Rich says he's been disabled for 14 years because he had a heart attack. But he's saying that he has another problem in addition to that he almost passed out a couple of times because his blood pressure got low. So he went and had some tests, but everything came back negative. So there is a fancy word for passing out or for fainting. You can look it up if you like, but it's called syncope, spelled S-Y-N-C-O-P-E. And what syncope means is your blood pressure drops low enough so that you don't get enough blood up to your brain, and when you don't have enough blood in your brain, you momentarily fall asleep, you pass out. It's not always the result of taking a drug. many things can do that. You've heard of people fainting sometimes if they're in pain. You've probably heard of people fainting sometimes if they, for instance, see something that they're afraid of. You've probably heard of people fainting sometimes when they see blood or when they see a needle. Many different reasons why people might have a sudden lowering of their blood pressure. What ordinarily happens is when our blood pressure drops low, there are certain feedback centers in our body that bring our blood pressure back up. For instance, there's a very common situation when people are laying down. When you lay down, your blood pressure is lower than when you're standing up, because your blood doesn't have to pump uphill to get blood from your heart up to your brain. When you're laying down, all of your arteries and your heart and your brain are at the same level, all on the same level. So your blood pressure goes down because it doesn't want to pound through your veins and arteries any harder than it needs to. There are certain sensors in your neck area here that control that type of feedback. So if your blood pressure is too low, these sensors send a signal down to your heart and your blood vessels, and they tell the blood vessels to constrict a little bit, to bump the pressure up. They tell your heart to beat a little bit faster. But sometimes there are reasons why those areas won't respond. There can be problems that people have with those sensors in our neck, and like for instance, if you have diabetes. If you have diabetes, you're not getting proper nutrition to the nerves and the sensors in that area, and they are not going to have the timeliness, because all these things depend upon time. Ordinarily, when we lay down, we stand up, we don't feel dizzy. But sometimes if we get up too quickly, like an emergency situation, if you get up too quickly and run down the hall to answer the phone or something like that, maybe you will get a little bit dizzy. Maybe you won't exactly pass out. Passing out, as Rich did, is probably the worst case scenario. So we'd want to ask, does Rich have any underlying conditions other than his heart problem? And remember that sometimes heart attack people will get certain drugs that will lower their blood pressure to make it easier on their heart. So that could be, he might be slightly over-medicated. He might have diabetes. He might have a very unhealthy diet. If he has a very unhealthy diet, he doesn't get the proper nutrition, he can strain a gland called the adrenal gland. The adrenal gland puts out many different hormones, but some of them have to do with how quickly those sensors that I was mentioning in our neck that detect blood pressure send feedback to the heart. So Rich's question isn't out of the ordinary, but something I would probably start with is a simple dietary diary. See what Rich is eating. Also ask him some other questions like, does he have diabetes? How many of the blood pressure pills is he taking a day? Unfortunately, there is not a good high-tech test for every single condition in the world. Rich is an example. He's had a heart problem. He's had this fainting, this syncope, this almost passing out situation for 14 years. Nobody has done the little simple things. He's probably been given every high-tech test in the world, but hasn't done any digging, the slow, tedious stuff like searching through his medical record, having a look at what he eats, and giving him some advice in that direction. Rich, you probably can be helped. It just takes going to somebody like a chiropractor who does look at nutrition and all the other factors rather than just giving you high-tech tests. So, Rich, I hope that'll help for you in the future. So let's go on to our next question. Lucille writes in from Danvers. She says, I got hurt last year in a car accident that broke my leg. Now my leg is all better, but I'm getting pain in my back, and my orthopedic doc wants me to get shots in my back. But how do you get pain in your back when it's your leg that was hurt? And how good are those shots in your back? Okay, so let's reiterate about Lucille. Lucille says she was hurt last year, broke her leg, and she was treated for that. Apparently the leg pain and the fracture has gone away. But now she says she has back pain, and she wants to know, well, how does having a broken leg lead to you having pain in the back? And her medical doctor wants to give her shots in her back. And she wants to know, well, how good are the shots that you get when you get shots in your back? Well, if you break your leg, it can change many things. If it doesn't change the length of that leg, it'll at least change the way you walk for a long time, and you might be in a cast or be on crutches for a long time. When you alter somebody's gait like that for a while, and who knows how long Lucille had to have a cast or how long it took for her to heal from that broken leg, it changed the way you walk. When you change the way somebody walks for long enough, you're definitely going to result in having some different twists, different torque, different strains on your back. And so it would be a miracle if you had a broken leg one year, if you didn't come down with something, who knows, knee, it could be hip, back, neck. The following year, yes, it makes perfect sense that a broken leg can result in pain in the back. Now the shots. When you talk about people getting shots, they say, well, what kind of shots are they going to give me? It's usually cortisone, might be some painkillers as well, but cortisone is an anti-inflammatory. And they have an effectiveness rate of about 18%. That's not very good. Anything less than 50% success rate, in my book, is really not worth the time to do it. But that's what medical doctors do. They give shots in the back when people have pain. My question is that going to change the reason why she came down with back pain? Because the reason that she came down with back pain, pretty likely, is walking around on an uneven surface for long enough so that you caused some of the joints in the area not to be able to move and slide and glide upon one another and have normal function. And giving a shot, is that going to restore that function? No. It's going to cover up the inflammation, because pain and inflammation go hand in hand. If you have a pain in the area, it's very likely that you have inflammation. So the shot will knock down the inflammation. It won't result in a true fix for that area. It won't result in resolving the reason why you had that pain. So Lucille, I'm sorry you broke your leg last year. Sorry you have back pain this year. You did need medical care for your leg last year, because medical doctors are great at fractures and dislocations. They're fantastic for that type of thing that involves acute trauma, not so good for chronic things where they take a certain degree of subtlety to get better. So I want to thank everybody for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and I'd like to offer you the ability to participate in the show. Send your questions into peabodychiropractic@gmail.com, or telephone my office at 978-535-6155, or feel free to send me an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll slightly disguise your name so your friends and neighbors won't know the nature of the condition you're inquiring about, and we'll talk about what natural health means to get you better. Because natural health means helps 80 to 90% of day-to-day healthcare problems without drugs or without surgery. So thanks again for watching. Bye-bye for now. I'm your host, Dr. Steve Blomerth. Thanks for watching. Bye-bye.